Good morning, everyone, and welcome back to the channel. It is currently 9 o'clock on the 12th of December. This time last year, I would have been literally sat in the hospital waiting to go in pre-surgery. Currently, I'm feeling great physically, mentally not too bad either. Just to tell you where I'm at, like right now, obviously. But this video, I'm going to have a little recap of what I've been going through over the last year. Go back over my surgery, my post-surgery, pre-surgery from my seizure. Talk about my recovery for running, getting back into running full time, doing the Great North Run, and then going on and just trying to progress and see how we get on. So I'm going to talk about the last year since being diagnosed and having my seizures and stuff like that. Hopefully this video will appeal to people who are possibly going through exactly what I've done. You've been diagnosed, you've had a seizure maybe, and you're waiting to go into surgery. I've done some videos in the past I've done one video in the past on like what the goal is for the channel, and it talked a little bit about my seizure, my diagnosis, and a bit of hospital. I'm going to go into a bit more depth into that. I'll timeline the video as well, so that if you're here because you just want to know about the running recovery, or you're going through the same issue yourself, then you can skip bits. If you're the carer or family member of someone that's going through the same situation and you want to know what it's like from their point of view, then again you can skip bits. That I'll timeline it all so that you can get an understanding of what I went through and what's going through my mind, so possibly help you to understand what's going through. If you know someone or you are going through it yourself, then you get an understanding of progression and what it was like for me, and hopefully it helps. Obviously my memory's pretty bad. It always has been, I guess. My memory's always been bad, but you can never put that down to anything. They've said like my cancer could have been around for 5 to 10 years, so that could always been an issue, but I don't think it is. They've said like where my cancer is, which is the right frontal lobe, it shouldn't affect my memory at all, but you never know. So I'll try and keep this nice and concise. Obviously I can edit it, but my memory's not too great. There's some areas of stuff, it was over a year ago, so trying to remember small details are they're not great, and I'm still struggling with stuff like that now. So yeah, I'm going to try and give you some concise information, but I'll try my best. And obviously my speaking's not so great either, because I stumble over words, but hopefully in editing I can fix a lot of that, but we'll see how we get on. So obviously today is a year from my surgery, but prior to my surgery, about 4 weeks before then, I had a seizure in my sleep. It was 4 o'clock in the morning. My wife did CPR on us to keep my heart going, obviously, because I'd stopped breathing. I had blue lips, and this is all, obviously, I don't remember any of this. This is all from what I've been told. I had blue lips, I was frothing at the mouth, I didn't look like I was breathing, so my wife started CPR on us, and she ran the ambulance. Ambulance came out. I'd had a seizure in my sleep. I had another seizure when the ambulance was here, and they started shaving my chest for defibs. So my wife had done obviously a brilliant job of keeping my heart going, and just keeping the blood circulating around my brain. The ambulance came, they saw I'd had a seizure because I had another one while I was here, and they just quickly started getting me ready to go to hospital. It was two small ladies, paramedics, so they called in for a lift ambulance, a lift team, bigger lads with the chairs and everything, to strap us up, because obviously I was upstairs in bed. They strapped us up, got us down the stairs, which I fought a lot apparently. I was grabbing a hold of banisters, I wasn't being a very good patient. But I didn't even know where I was. I think I was asking my wife, and my mum was here at the time because she came to look after my son, who was 1 at the time. Apparently I knew I was in bed. It was November, but I thought it was like June or July. I didn't even know what year it was. The paramedic was asking do I know who she is or what her job is, and I couldn't tell her a bloody thing. So although I was there and I was speaking, I hadn't a clue where I was. I was still like in this seizure phase. So they got us down the stairs anyway. I was fighting. I was grabbing hold of banisters. I didn't want to go with them, I guess. But I was kind of out of my mind, I guess. I didn't really know what I was doing. So they got me in the ambulance. I had another seizure on the way to hospital. Went straight in, obviously, ambulance care. Had another seizure in there. And I think originally they thought I was having a stroke. So I went into the stroke ward. This was on, what was this? This would be Monday morning, like Sunday night, going to bed, Monday morning. And I don't know whether I woke up on the Monday or I woke up on the Tuesday, but I woke up in the stroke ward and they'd obviously done loads of scans when I was out. They gave us some medication during that time to stop the seizures so they could like work out what was wrong with us. Did loads of scans, obviously saw I had a tumour. And then obviously when I woke up and came round, they told me and my family that I'd had a tumour. They'd saw it on the scans or what. Yeah, I'd also had kidney trauma or kidney failure, like a grade 2 or a level 2 kidney trauma. So they weren't going to let me out of hospital until that had gone away. So I was on a drip the whole time, like giving us fluids or what have you. I'm not quite sure. And I got I struggled this word in my original video as well. I got discharged from there. And at the time, my cousin who works at HDU in the RVI in Newcastle, he's worked there for like 20 years. He'd contacted a consultant, went straight round, one of the best brain surgeons in the country. Went and had a chat with him. I had asked at Cramlington if I could see him because I had a request to see a specific consultant. Went in to see him and obviously he looked at my scans and said straight away, like he could pretty much tell what kind of cancer it was. He could tell it was cancerous. Just from looking at the tumour from the MRIs they'd had. And it was quite big. They were saying it wasn't big, and obviously, I don't know, but you know, it looks massive to me, and obviously I'll put the scans on screen. It looked fairly large. It's a large section of my brain. So I went in, I had seen him, and obviously he talked to us about the procedures and what he thought and all this kind of stuff. He didn't seem overly concerned, but obviously without a biopsy, he couldn't tell us for certain, so he wasn't going to like label it instantly, but he was pretty confident that it was an astrocytoma. And depending on what mutation of astrocytoma really depends on what grade it is as well. I can't remember if he'd said what grade it was. But yeah, so we had to wait for the biopsy. And during all this time, like obviously I'm listening to him talk and it's just words. Like I don't think I was taking a lot of information in. I can't remember much of anything around that time. Whether that's the trauma, I think I've said this in a video a little while ago, whether that's like your brain's defense, your trauma, like memories, the medication I was on, because I was on a lot of heavy medication at the time to try and suppress the seizures. And I think I was still on some steroids at the time. And then obviously you're taking medication to counteract this damage the steroids can do to your stomach. So I was on a lot of heavy medication to try and keep me safe. But yeah, went into surgery. I got an appointment for surgery 2 weeks later, but they couldn't do it because the wards were full of COVID patients still. So 2 weeks after that, I had my surgery. I wasn't actually worried about surgery whatsoever because I knew they were going to knock us out, and I genuinely didn't have any fear of it because, you know, I was going to be knocked out. I didn't know what to expect, to be fair. I'd never ever been in hospital overnight on my own, like for myself. I'd been in hospital overnight looking after my little one when he was in, to be there with my wife. But personally, I'd never ever spent a night in hospital ever. Obviously, I'd been a runner. I'd done muscles and pulled hamstrings and done ligaments and, you know, sprains and minor stuff, but I'd never ever spent a night in hospital, so I had no idea what to expect. Obviously I've got notes here, so if you see me looking down, that's what I'm doing. So yeah, I went in 2 weeks later, no fear whatsoever. A little bit shameful actually, because when I went in for my appointment, they asked me my wife's date of birth and I literally couldn't tell them. I had no idea what my wife's date of birth is, and I've been with my wife for 23 years. So that kind of shows how bad I was at the time. Like my brains were just all over the shop. But I wasn't scared about surgery whatsoever. Obviously, I was still fatigued and struggling from the seizure. My seizure was actually, the 4 seizures I had were actually, I was told that was one major seizure over 45 minutes because I never came around from it. So that was obviously concerning to them, and I think that's probably what did my kidneys in as well. But yeah, so I ended up having my surgery at 9 o'clock. Well, it was like 9:30 possibly. I can't really remember. Today, obviously, as I've said. But yeah, my brains don't really work too well. So yeah, went in for surgery, came out of that. Actually, on the way into surgery, I had a load of needles. I'm absolutely petrified of needles, by the way. I hate them. Don't even like going for like vaccinations to go to Thailand and stuff like that, or Mexico. Hate them with a passion. Wouldn't opt to get a needle ever. Like, I know I've got to get them and I have to look away from them. I build up this like weird anxiety when I know I've got to go for one. And it just sets my heart rate off, and it's I don't deal with them very well at all. So I went in, and obviously I knew I had to have cannulas. So they put one in my wrist for the anaesthetism, or anaesthetic, I guess is the word. The anaesthetic to knock us out for surgery. And she's like, does it, like, if it stings a little bit, let me know. And it absolutely knacked. It was like someone was putting lava into me veins, and I could feel it like right up my arm. And I was saying to her, like, I was like, no, that's not right. And she looked at the machine, and she was like, yeah, like, I don't know what tells. Obviously I'm not medically trained at all. And she was like, yeah, something's not right there. So they did something, and that was it. I was gone. Yeah, so as I was saying, I just had a phone call, so that's going to butcher us. Yeah, so they'd fixed whatever was wrong with the cannula that stuck into us, and that was it. Next thing I know, I'm waking up in HDU. Don't really remember a lot in HDU, obviously, heavy medication. The only things I really remember, actually, are I literally couldn't cut my food, so I had to get one of the nurses to cut me food because it was like chicken breasts or something, and I couldn't work knife and forks. And it wasn't that I couldn't work them, it was almost like my strength. I couldn't work out my own strength. So like opening juice pops as well, like, like just a little pot of juice with a foil lid. I had to get someone to do that for us, like the whole time I was in hospital, because I didn't want to like pop it and like just throw up juice everywhere, because I literally couldn't control my own like strength, I guess. Like them working out those like little finer details of just doing something gently. Couldn't do it. So every time we had like meat or something like that, I'd have a nurse cut it for us in little chunks. And actually I remember sitting there with like my phone in my hand or something, or my food would be there, and I'd completely forgot it was even there. And obviously my wife and that would come in, and they'd sit with us and they'd be like, Paul, your dinner's there. And I'm like, oh, I know, I just kind of forgot. Like, I could see it. It's weird, but I could see it, and I knew it was there, but I don't know, there's like nothing triggering in my brain to eat it. And that was something they said that would happen, like these like initiation triggers. So even like trying to go to the toilet, I would leave it until like the last minute, like almost pay myself before like I would nip off to the toilet. Yeah, so when I first woke up, obviously I had a catheter in, because whenever you go in for surgery, you get a catheter fit. And that was probably one of the worst parts about being in hospital, actually having a catheter in, because it just constantly feels like you're peeing yourself, because I think technically you're constantly basically dribbling, and it's just going into a bag. But obviously I couldn't just get up and go to the toilet whenever I wanted. They wouldn't let me. So, and that was even after they took the catheter out. I had to have like permission to get up and walk about, because originally someone would have to like grab it and come with us, like go for washes and stuff like that, to go for a shower. So actually, once they had the catheter out, I still had to ask permission to go to the toilet, which was a pain, obviously. But I think I'd done that to myself, because I remember a time where I was in the ward, because I got let out of HDU at like 11 o'clock that night. I don't remember a lot of being in HDU, but I was only there for like 10 hours. So I woke up at about 1 o'clock. My surgery was 4 or 5 hours. Woke up at 1 o'clock that I remember coming round. And my wife and my mum were already there. And I remember the nurses and stuff. I don't remember what I felt like. I think I was just really dazed and kind of confused a bit. But I wasn't in any pain. Because they said, like, if you're in any pain, like, obviously give us a shout and then give us morphine and stuff like that, which is absolutely horrendous, by the way. Taking morphine. It does the job. It does the job, certainly, but it's not a good... Not a good experience. Didn't enjoy that at all. But yeah, the catheter was the catheter. Yeah, the catheter was really annoying. Probably the worst thing about being in hospital, because you just constantly feel like you're pissing yourself. And then having to get permission to go to the toilet, like I said. The day staff had actually like sorted me out. Oh, I was going to say something else, wasn't I? Yeah, I didn't help myself because my wife had been on the phone at some point when I was in the other ward. And I said I would get up and go to the phone to get her, to speak to her. But it was at the nurse's desk, like at the reception, just around the corner. And it wasn't far. It was probably only about 10, 15 meters. But I was stood on the phone talking to my wife, and I could kind of feel the sensation that I was going to pass out, but I didn't say anything. And I passed out, essentially. Phone hit the deck. I don't think I hit the deck. I think I caught myself on the desk in one of the nurses' quarters. But I think after that, they'd kind of collared us and been like, right, he's a bit daft. He doesn't really open his mouth when he's going to pass out. So I think I didn't do myself any favour. So when I wanted to go to the toilet after that, like I had to have someone with us constantly, which is absolutely fine. They would just wait outside the door for us. But it just meant like ringing the bell and being like, right, can someone take us to the toilet? Rather than just having the freedom to just go and do whatever I wanted. And I think that was my fault. But yeah, being in the wards and that wasn't too bad. Obviously, they come around and check you every 2 hours, which is really annoying. You didn't get any sleep because there's beeping and buzzing, and obviously you're in a ward full of other people that have had strokes. They've had all sorts of brain conditions. People being hit and run, car crashes. There's a lot of people in there that are struggling with like mental ability, cognitive abilities. They don't even know where they are. They don't know their own names. It's disconcerting being in there. It's definitely one of the worst experiences about it, but it's not the end of the world. You stick to yourself. You do what you do. You have your medication. You eat your food. They come around every 2 hours and ask you who you are, where you are, and I was pretty all right. That's why I got out of the HDU as quick as I could, because I was looking around and there's lads in there that are really like struggling. Like they're not like. I think I was in the good side of it, because obviously there's a bad side of HD where people are on ventilators who can't, they're on life support. Those are obviously very serious. And I was not too bad. Like I could speak and I could talk. There were guys like opposite me who were brain damaged and they couldn't talk. But then I was looking at them thinking like, I'm fine. I'm sitting here chatting with the nurses where, having a bit of banter, asking who I am and stuff. And I was absolutely fine. I felt fine. Felt absolutely brilliant. You do the whole way through. You feel in yourself like you're completely normal. And people that are coming in to visit you are probably thinking like, Jesus Christ, he's absolutely out of his mind. But within myself, I felt absolutely fine the whole way through. Never felt any different, to be fair. But like I say, they come round and check you every 2 hours. They do your observations, make sure you're all right, make sure you're having your medication. They'll do like ear tests and eye tests and just make sure you're all right, I guess. Which obviously when you're trying to have a kip, it's really annoying. I mean, it's bad enough in there. Like I said, like there's people in there that are like, they're brain damaged and they don't even know where they are. They're struggling mentally a lot. Want to go home, so they're up there and they're ripping their tubes out. And I had 2 cannulas in this hand, an arterial line, which my cousin said was going to absolutely knack when they pulled it out, because he obviously works in hospitals, and it didn't hurt at all. I had 3 or 4 in this hand, so I was wired up like there's no tomorrow. And like I said, I'm absolutely shit scared of needles. I hate them, but they weren't any bad. They came out. The worst thing about them was the sticky paper on me bloody on me hairs, ripping the hairs off. Absolutely awful. But yeah, the hospital wasn't too bad. Like I knew they're observing you, and if you eat your food, you take your medication, you respond well to the questions, and you ask, cognitively you seem all right. I got out there in 4 days. 4 days after brain surgery, and it wasn't too bad. Like I said, I was in the RVI in Newcastle, and it was brilliant. It was absolutely fine. I had friends coming in, family coming in. The other people doing the lads I was in with, I was sharing a room with like 4 lads. And they were brilliant. 2 older guys who'd had strokes or whatever, fell over and had injuries, and another guy who had like a spinal arthritis, so he'd had spine surgery, and it was fine. We just used to have a bit of chatter, bit of conversation, and then like I say, you do your checks and your stuff when they come round, and it's not too bad. Like I say, like time is definitely makes you forget how bad things were, but I think. And like I said, you always feel okay. You always feel like you're just normal, but you're obviously not. You just had major brain surgery. So obviously after that, I came home after surgery. Came home, and that it got a little bit more difficult there because I've got a 2-year-old. Not that he was a problem when I had a 1-year-old at the time, but it was like Christmas time. I'd missed loads of stuff that we wanted to do with the little one. Like my family all went on trips on Christmas trains to see Santa and stuff like that, and I missed all of that. So this year my wife's making up to it. Next week we've got absolutely loads planned. One thing I do remember struggling with is I'd chosen to go to Asda with my wife just to do a bit of shopping with her because I was trying to get back to normal as quick as possible. I wanted to do everything I'd always done before, and nothing mental. You're just going around the house, you're doing a bit of food, do a bit of shopping, do some jobs around the house, tidying up and dishes and stuff like that. But yeah, when I went to Asda, oh man, struggled massively. It was almost like there was just too much going on for my brain. There's people all over, it's bright lights, they've got music on, there's loads of noise, and that was far too much going on for me to try and comprehend and work out. And yeah, I struggled massively doing that. It was far too early to be out and about. So we just sat in the house, chilled, did out basically, and I remember we had a discussion with my oncologist after that, and I was getting like headaches every now and again. And she said basically, if you're getting headaches, it's your body's way of telling you that you're doing too much and you need to slow down, you need to take a step back. So we kind of try to implement that. We try to stop and do less. And although I wanted to run before I was walking, and like I said, I wanted to get my life back to normal as quick as I could, because that's all you want really. You just want to crack on and get on with it. Well, I did. And it just it didn't really work too well, so try to take a step back from doing that. And my poor wife as well, I just wanted to help her out. We had 1-year-old running around. We had my mum staying with us for a month over Christmas to try and help out as well, which did help. It was lovely to have more people around and just have conversations. I don't think I was very good. I was having naps, and I never nap. This one thing, people that know me will say, if I go for a nap in an afternoon, I always wake up feeling like I've got a hangover. I feel so much worse for having it, so I just don't do them. I avoid them. But fatigue-wise, I couldn't hold off. I'd be sat on the chair watching TV, and I would just nod off. I'd be gone. So I was trying to get in as much rest as I could, taking my medication. I hate needles, and I had to have a needle every single day for blood thinners. Awful. Hated it. Yous might be the same. You might be fine if you don't mind needles. But they were in hospital, they were like, oh, I'll teach you how to self-inject them and stuff. And I was like, absolutely not. I was like, I'm not injecting myself. So I'd said, get the nurse round, because I didn't want my wife doing it either, because she'd done them the year before, because when we'd had the baby, she had to give herself them. Honestly, nah. I was like, I'm not trusting her with a bloody needle. And my wife works in healthcare. She's a dental nurse. So she's not used to injecting people, obviously, but she's been around that kind of stuff a lot. But watching her inject herself, I was like, she's not doing that to me. Absolutely not. So I'd said, let's get the nurse round. And the first nurse that came out was absolutely lovely. Never felt a thing. The next nurse that came out was honestly, it was shoving a spear in her. She absolutely knacked. And I had a bruise this big off her. And I was and just waiting for them to come round. You never knew when they were going to come. And it was just a bit more of a pain in the arse. We didn't have as much flexibility. We couldn't go and do things and do what we wanted. So we're sitting waiting in the house with these nurses. So eventually we just sacked the nurses off, and I just got my wife to do it. So we had to do them needles every day. That was a bit of a pain, but I have a fear of needles, so that's not great for me. But during that time was just sitting in the house chilling, rest as much as you can. Shower was a big problem. My first ever shower at home. I had to have a chair. I had to get a little stool, put it in the shower cubicle, and get my wife to gently put water on my head, because you might know this already, but obviously when they've cut my head open, they've obviously took this is a bit brutal by the way, they've took my scalp off, so peel my scalp off so they can cut my head open and obviously crack my skull. All those nerves from where my scar is to my crown, all the nerves in my head are completely gone. I can't feel anything around here, nothing. So I was really scared to touch the scab on my head. Really, really like just avoid anything touching my head. So even just putting water on it gently with a shower head, I was like, oh Jesus, I had to get my wife to do it because I couldn't feel anything. Everything was swollen. Yeah, it felt pretty rough. So yeah, my wife basically had to shower us for a good few weeks until I built up the confidence to be able to like rub soap in. And we were using Sanux, I think, which is it's like a non-fragrant shampoo, which my cousin recommended. Obviously, I say he works in HDU. He recommended Sanux, so we used that and we bought a massive bottle. Because obviously, without being in surgery and not like having a wash or anything properly, because I was having body washes, but obviously I hadn't washed my head until the scars and scabs had come over properly. Because obviously I had 28 clips across my head. So yeah, I didn't touch my head at all for like a couple of weeks, and obviously my scalp was like really dry, so I needed my wife to like exfoliate it to get in. See you later, Fred. Exfoliating my scalp because just to like relieve some of that itch, because my scab wasn't itchy, it was more the dry skin around here where even though I can't feel it, it was just really itchy. And to go back on what I was saying earlier with the needles, that actually, I think what I've learned since then is like if I rub my wrist here, like I can feel little shocks in my finger, and this is a year on, I can still do this. And my finger here is completely numb. So my cousin, obviously medically trained, he reckons they've scraped a nerve in my wrist here when they've put the cannula in to do the anaesthetic. Because obviously, like I say, I can feel it here, and when my son waxes there every now and again when we're play fighting, I send shock like right up my finger. So that's uncomfortable, and that's still happening in a year on, but my cousin reckons that'll probably never come back. Like that feeling's gone and I'll never ever feel it again, which is quite bizarre. It's quite odd, but I think that's just a one-off. Unless they scrape your nerves when they're putting needles in you, and I didn't feel it. I didn't feel I do that. It's just apparently that's what happened. So yeah, showers and that, bit rough, but have to be done. You stink. So yeah, got all that done, went through that, and then getting the clips out. Like I said, I don't like needles, I don't like any of that kind of stuff. The lady came out to do my clips, and I think I like built up the anxiety in my own head to deal with like getting these clips pulled out, because I was messaging on one of my running friends who's a nurse, and I was asking her like what's all that about, and basically she said it's only bad when, because obviously the scab over, and when they're pulling the clips out, the scabs come off as well, and that's not too great. I had to lie on the floor. Basically, I was going to pass out. And obviously, if you're already lying on the floor, you can't pass out. So if you're worried about that kind of thing, then yeah, just lie on the floor, get a pillow. And to be fair, they pulled them out within like 5 minutes. A couple of minutes they were here. Pulled them out. A couple of them were a bit nasty on the edges on either side, because obviously my scar goes from here to here. Can't really feel it that well because obviously my head's numb. But yeah, about there. So I've got a whopping scar. So yeah, get my clips out, wasn't too great. My head's still numb. And then obviously that was like a few weeks afterwards. And meanwhile, obviously they took a chunk of my cancer away, and that was all getting scanned. So we went in for a meeting with the neurosurgeon to find out like what kind of cancer I had, essentially. And yeah, he was right. It was a grade 2. It was an astrocytoma, but it was a grade 2. So it wasn't too bad. But we still needed to find out the mutation. And I still don't know a lot about cancer. Obviously, I know nothing, basically. Just what they've told us. And even then, I was kind of out of my mind when they were telling us and trying to listen, but you're kind of traumatized at the same time. Because the whole thing is obviously massive amounts of trauma for me and my family. But just like, it's so surreal, this sitting there, you're like literally sitting there and the guy's telling you like, mate, you've got cancer, we're going to have to do surgery, this is the procedure, we're going to, smash your skull open essentially. And I think one of the things, this might not help you by the way, is if you're come here and you're waiting to go into surgery or something like that, one of the things they told us afterwards was essentially they treat me like a car crash victim, because they've had to physically smash my skull open to get to the cancer. They've had to, crack my skull. Obviously in surgical conditions and stuff where it's all monitored and controlled. But yeah, post surgery they treat you like you're treating you like a car crash victim, which is kind of disconcerting to hear. But at the end of the day, like, they have to be realistic with you. And So yeah, we went in to see my surgeon, and he was saying they only test the cancer for like the most common mutations, and I didn't have that. So my cancer, which is just like, you're like, oh, you want to know, like, look, this is what it is, this is what's going to happen, this is how long it's going to take, blah 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 blah. Like, what's my prognosis? Like, how long am I going to live for, basically. And I don't think anyone actually told me that until we went to see my oncologist, which I think was 3 months in or post surgery. So yeah, my surgeon was basically, you don't have the most common mutation of that cancer, of grade 2 astrocytoma, so we have to send it off for more tests. There are 14 types of mutations, and obviously, you've got family members. My mum was the worst. She's Googling everything under the sun and messaging us stuff, and I'm like, I didn't want to know. I didn't care. Like, I do care, obviously, but I just would rather not be Googling stuff and scaring the crap out of myself. So I completely avoided, I didn't watch any surgical stuff pre-surgery. Like, I didn't watch anything. Obviously, I didn't want to know. I didn't want to know what was happening. Like, why the hell would I want to know that? So I didn't Google anything. I was trying not to, like, research any information. Any information I wanted was from the team that were looking after me. They know my case specifically. And I would, if you're someone that's a family member of someone going in for this, the same as what I was, just didn't tell them anyway, because my mum was telling us, and I'm just like, that doesn't help. Doesn't help one bit. Like, guessing in, I mean, it's logical. Like, why? Like, it doesn't help. So obviously being told, like, it's going to be another 6 weeks to find out what kind of mutation you've got. I had to go after Leeds to, like, special bloody science lab, whatever. So obviously they sent all that off, and I can't remember if it was the neurosurgeon we saw again to tell us or the oncologist. Honestly can't remember, but I had a scan. Basically, I had a scan directly straight after my surgery. I think it was like the day after they take you in for another scan, and there was a grey area. This is kind of jumping about a bit, apologies. There was a grey area on my scan. Initially the surgeon had said, like, we'd had a really good resection. He'd actually had like a little inkling that he wanted to do a little bit more investigation while he was in there in my brain. So he got the ultrasound out, scanned my brain with the ultrasound, and he could see a little bit more cancer underneath where he'd already been. So really good intuition from him. Obviously went in, took that cancer out as well. So he'd got way more than what he expected. But yeah, my MRI that I had directly after surgery, like a day after, or maybe it's that day, I can't remember. There was a grey patch on there that obviously the MRI team, the radio people, I have no idea what they call them. The MRI team had like flagged up. He was confident that was just a bit of like bruising or what have you on my brain, or a little bit of like something showing on the scan from him basically prodding around in there from doing that ultrasound and getting a bit deeper. But obviously they had to flag it, and we wouldn't find out until my scan 3 months post-surgery. Because initially they were telling us I would have to have 3 monthly scans, but that would increase through the years and months. And you'd go from 3 to 4 to 6, and eventually it would be like every year or something you'd be going for a scan. Currently right now I'm still on like 4 monthly, so I had one in 3 months. And they told us basically like my mutation was like IDH mutated. No idea what that means. Still haven't, but apparently it's really good. A really good prognosis, essentially. It's like if you've got brain cancer, mine is the best outcome you can get. Grade 2 astrocytoma, IDH mutated. No idea what any of that means. But apparently it's good, so I'll take it. And I think after that, I'd actually researched some of the mutations, and I think some of them you can die within like 3 months. They can like 3 weeks maybe. 3 weeks, 3 months. There's massive variances in prognosis from the different mutations. But mine, yeah, apparently I get, I'm all right. I'm all right. Yeah, seeing the surgeon, the oncologist, 10 years is my prognosis for treatment. So essentially what that means is I get 10 years worth of treatment, and then there's nothing else they can do for us. Which is that's kind of hard to take at the time. Because nobody had told me anything up to then, like how long I was going to live, because obviously they didn't know what mutation I had. So yeah, learning that was pretty brutal. But 10 years, and that's like average. That's not best case, it's not worst case, that's average stuff. So, and I think in my mind, that's why I wanted to get back to running as quick as I could, because they've lined up, like they were telling us, the treatments I can have. There's with the IDH mutation that I've got, there's a trial drug at the minute, which is still on trial. I can have chemo and I can have radiotherapy, but obviously they don't want to start any of that until I need it. So they're going to keep scanning us. That 3-month trial actually showed that, like I said at the time, that little grey patch, the surgeon had a good inkling that it was that was just him poking around in there. Turns out he was right. As I said, like one of the best surgeons in the country, brain surgeons. So him poking around in there, it just showed up flagged a little bit of stuff on the MRI, and a 3-month scan, absolutely fine, nothing on there. Being told I've got a decent mutation, I've got 10 years as my average prognosis. So yeah, deal with that, and then just to come back, I think it was 3 months or 4 months after that. So I had it in March. July was my next scan. What's that in March, April, May, June, July? Even doing that like with my fingers, it's 4 months. Yeah, 4 months. And then I had a scan in July, 4 months. That was fine as well. Nothing on that. But again, yeah, they don't want to start any treatment until I need it. So until something starts to show on my scan, and my cancer is a really slow growing one, as I said earlier, like they reckon I'd probably had my cancer for 5 to 10 years based on the size of it and the type of what it is. Like that's how long I've likely had it for. That's how long it's been grown. So the chances of me, like I'm having scans obviously to make sure it doesn't come back, or if it does come back they can get on it, but I'll likely have no symptoms anyway, because it's just not that kind of cancer. It'll take years for it to grow to the size that it did previously to cause the seizure. So I'll not feel it. I'll not know that it's there until I get a scan and something shows. So my July scan also showed nothing. And then the scan I had in November, it's obviously 12th of December now, I think, yeah, since I had it, December. I'm waiting for the results from that one, and I'll get those results in July. It takes a while for the results, which is a bit of a pain, but at the end of the day, I'm not going anywhere. Well, I hope I'm not going anywhere. So that's basically recovery, surgery, hospital. Obviously, if you're here because you've been diagnosed, or you've just had surgery, or you're a family member of someone, and you've got questions or answers about any of that kind of stuff, then throw them in the comments. Obviously, I've been through it myself. I can try and give you some sort of information or some sort of help. Anything basically, chuck it in the comments, and I'll answer your questions. We'll see. I'll see if I can help. I don't know. Obviously, I haven't been through it. My memory's shite. My memory's pretty terrible, but I'll try my best. So yeah, hopefully that'll give you some sort of insight into that. I knew early on, like even when I was in hospital, like lying in a hospital bed in a ward, like I wanted to get back to running, because I've got this, like I've always had this weird kind of like health anxiety, and that's why I've kept myself fit and healthy. I've ran for 10 years or something. Always kept myself fit and healthy. Always have. Always ate well. Never really let myself go, body wise and health wise. Always try to look after myself, because I've had a bit of a weird health anxiety where I've always wanted to try and live. In my mind, I've always wanted to try and live as long as I could. I've always tried to want to like get to like my late 70s or 80s to spend as much time with my wife, enjoy retirement, enjoy pension. So I've always had a bit of a health anxiety with all of that, and the male side of my family haven't really lived, on both sides of my grandparents haven't really lived to late years. 60s is probably the oldest. So I've always had a weird bit of anxiety about that, and then obviously getting diagnosed with brain cancer didn't bloody help. Apparently, like the fitness that I had, like there's no way I would have recovered from surgery, or the seizures or the cancer would have affected us a lot more and a lot worse hadn't I been so fit. Because I was fit and healthy, but lying in hospital bed, like I just wanted to get back to it. I wanted to get back to running. I wanted to get back to normal. I wanted to get back to work. I just wanted to get out there and just, get my life back, essentially. I didn't want this to stop me. even lying in the hospital bed, the Great North Run was like in my sights. I'm like, right, I want to try and get to the Great North Run. I've run it 4 years in a row. This will be 5th. And I knew it would be a massive goal, and I'd mentioned it to the surgeon, and it's just like, like that's lofty heights, that, mate, being realistic with us. But if anything, that just fueled me more. So I think I said this in a previous video. I'd looked around online to see if there was any kind of information out there about like when can you return to running, even as early as like literally lying in my hospital bed. I hadn't even left hospital, so within 4 days of surgery, I'm looking at how can I get back to running, when can I get back to running, timing wise. Spoke to my neurosurgeon. He's like, Great North Runs, like that's not a thing. You can't do that. That was 9 months. So it's in September. So just what was that? 9? Was it 10? 10 months? Yeah, 10 months. It would have been 10 months since surgery to get back to. No, it's 9. It's 9 months. Yeah, it's 9 months to get back to a half marathon distance. And I couldn't find any information. Like, there's just now out there. There was nothing. There's no, like, I watch a lot of YouTubers as well, a lot of running content. Andy, it's on Andy, Philly Bowden, Sage Kennedy. I watch tons and tons of footage. Like, I work from home. So when I'm having my dinners and stuff like that, I'll just chuck some clips on and I'll sit and watch YouTube running videos, and they inspire us. They always have. You see them going through their ups and downs, and when you're running and you get injured, it's your ups and downs yourself. So I was looking for stuff out there, and there was just nout. There was literally nothing to tell me, like, look, you've got cancer, it's fine, you can return to running, do it sensibly, what have you, but like, this is what I did, and there was nothing, literally nothing. So I thought about doing it, creating the videos, but obviously, like I said, I didn't have any cameras. I don't really sit in front of videos. I don't get up and speak at work. I've never done any of that kind of stuff. Don't really like it. Wasn't really confident in doing it. So I thought about doing the videos. I actually started running in March, but I took it so slow. Like, I'd had me meeting with the oncologist, asked her about it, and she was the same. Like, you can run, but just take it very easy. And if you're getting headaches, like I said previously, if you're getting headaches, that's your body kind of saying, like, watch what you're doing, take it slow. But I'd asked her, I'm like, but if I do get headaches, am I going to do myself any long-term damage? And she's just like, no, you can't do any damage. And I'm like, well, if I can't do any damage, then I'm good. You know what I mean? That was it. That's the kind of confidence that I needed from her. You can't do any damage, but you probably should watch what you're doing. So I started off, when I started running, I was literally doing like 400 meters. That was it. I like the block in my street, 400 meters, that was it. And I was absolutely cacking myself, I'm not gonna lie. I was really worried about like the headaches and what was gonna happen, because I was still having headaches just doing housework. But I thought, it's time. I can get out there, I can walk about. I was fine then, walking and being on my own, like walking around. I still was getting the lads. Like, I started off walking. Obviously, I've got a dog, so the lads who I normally walk with, me mates who live on the same street, I would go out and meet them because they work from home as well. So we'd walk the dog twice a day, and we'd always done that previously. So I just joined in with them. And I'd go out for a slow walk with them. Obviously, started off really slow, and then eventually started jogging. But I'd only do like 400 meters, and then it was just, since then, like, what was that, March? It's December. Since then, it's just been finding out like how far you can push that little bit of a time. So started off really slow, and it's just like, right, can I do 400 meters? Yes, I can. Okay, can I do 2 laps of the block? Can I do 800 meters? Yeah, sure. Can I do a kilometer? And just gradually doing it. And if it's like, can I do a kilometer? What kind of pace am I running? 6-minute kilometers. Cool. Can I do it at 5:30? Do it at 5:30. Get headaches. Okay, that's my level there. Don't do that again. Bring it back down a little bit. And then eventually building it up really slowly until I was doing like part runs. And then my wife, because I'm banned from driving, and I still am, to be fair, I'm still banned from driving. I haven't got my license back. So I'm not allowed to drive because it's brain surgery, and I had a cancer. So I've got cancer. So I'm not allowed to drive. So my wife would take us to part run. So she was there watching us. And I didn't really need that, but she did, because she had like massive amounts of health anxiety as well about me. I mean, obviously she'd seen me nearly die and have to do CPR. That's massive amounts of trauma for her. And I was aware of that, and I still am, still massively aware of like her and her needs and what I can do to help her. But yeah, anyway, running. So I started off really slow, and I think I did like a 25 or a 26 minute 5K park run, and that wasn't great. Like the headaches were, when I got headaches from that, and it was wiping us out for like 2 days. So I knew like straight away, like that's just too much. Like I need to back down from that. Like that's not good. So I backed down from that, and I still had the goal of like great enough running in my mind. Didn't obviously tell my wife about it because she wasn't having any of that. No chance. No way I was doing a half marathon 9 months after surgery. As I said, she had like massive amounts of anxiety, probably worse than what I did. So yeah, but just basically, yeah, got headaches, backed off that pace, that's too much. And it was just a case of like, obviously when the headaches come, like I had headaches for like 2 days. So I was basically, I didn't want to go anywhere, didn't want to do out, didn't have the energy, just lock me in a dark room. And that's no good. Like if I'm doing that on a Saturday, that's all my Saturday ruined, all my Sunday ruined. And it's like the only time my wife gets off work and we've got to go do shopping, I've got to help out with the little one. Because I wanted to do that. I wanted to get back. I say I want to get back to normal. I want to do my jobs. I want to help my wife. I want to help my son. I want to help raise him. I'm a dad, and I want to be a part of that life. I forgot to mention actually, Christmas was a total write-off last year. Like I said, when I was in Asda, it was just absolutely too much for my brain to handle at that time. And Christmas was the same. Woke up Christmas morning, and even though we were just sitting in the sitting room and we were opening presents, but it was just like, I don't know what it is. I don't know whether it was like early mornings. Like it used to take me a good hour to kind of get my brain like wake up properly. So just waking up Christmas morning with a little one, and we're all excited. We want to do presents. And I wanted to do them as well. I wanted to see his reaction. First Christmas with him. But it was just like, what is it? Sensory overload, essentially. Just too much noise, too much lights, a lot going on. Taking photos, taking videos, trying to take it all in and be there present in the moment. And although you are, like I said, sensory overload, there's just too much going on for me to take anything in. So we had to basically pause opening presents, go have breakfast, and then come back to it later on. In Christmas last year was an absolute write-off. So we're trying to do as much as we can this year because I feel way better, and try and like really experience it. And I missed his first birthday. You know what I mean? I was in hospital. I was between seizure and surgery, so I was still completely knackered. Like I said, my memory's totally gone of that area. So yeah, not great. Christmas was a write-off. And yeah, as I say, it used to take me a good hour to wake up properly, like to get myself into normal mode. So yeah, can't remember where I was now. Yeah, see, this happens. Like I'll be talking about something, split off, talk about something else, and I've got no idea what I was just saying. So yeah, I knew that pace was too much, so I basically had to back off. And this has been like if you're trying to get back in the run, and this is something I've had to do constantly, and it's finding out where your levels are currently, like your fitness goals. Find out where your levels are, see how your body reacts to it, and then obviously if you're doing all right, you can push a little bit more. If you're not, then either keep it at that level or back it off. And this has been like a constant thing that I've been doing over the last 7 or 8 months since trying to get back to running, and that's been like a massive amount of anxiety for myself because I haven't wanted to get the headaches because, like I say, it wipes us out for a couple of days, and I've got work to do. I've got I've got a life to try and live, and if I'm wiping myself out for 2 days, it's just not good. It's not a way to live. So I've been constantly like battling with the headaches and trying to work out where I'm at, and it's just confidence. It's trying to figure out the confidence. Sorry, what are they doing? Yeah, it's just confidence, trying to work out where you are, where your levels are, where your fitness is at, in trying to push. Obviously, I've entered. If you've been watching my channel a lot, I've entered a Grand Prix. And yeah, so I just constantly, I just kept trying to figure out where I was, and I kept my 5Ks at about the same pace, like 26s and 27s. I just decided like that's where I'm at, and I'm not going to go any faster than that. And to be fair, I didn't really need to at the time. Like I hadn't ran for a good few months. That's my dog. Yeah, so obviously I hadn't ran for like 4 or 5 months, and I felt like I'd reset my muscles in my legs, and I needed to build that stamina, build those muscles back up, and get myself back to a position where I could start pushing a bit better. But also with the goal in mind that I wanted to do the Great North Run. So obviously I still had the goal in my mind that I wanted to do the Great North Run, and my wife came in from work one day and had suggested that someone that she works with, who also runs at the same running club with me, would partner me in basically go around the Great North Run with us. And I was like, well, so if that's what you're talking about, that must mean that I'm allowed to run it, right? And she was like, well, yeah, if Katie agrees, then I can run. So from that moment on, then I'd started trying to increase my mileage, because I knew I had to do it slowly. So like I said, to build that muscle and get my fitness back. So I was doing part runs, and I was trying to do like my long runs as well, and just gradually, like I'd went through a phase of trying to increase my mileage a couple of years previous, when I was trying to get up to 20 miles to do the Chevy Chase. And I'd basically just increased my mileage like 1 mile a week or something like that, or a kilometre a fortnight, or a mile a fortnight, can't really remember. So I decided that I was going to stick to that same pattern. So every fortnight I put another mile on in my long run. And that worked absolutely brilliant for us again. It's something that worked for us previously, and it worked for us. And it was just confidence. I was going out and I was taking it really slow. I wasn't running anything quick. Did the Great North Run. Did get there, did it. Didn't have a very good run, and I hadn't trained at the pace that I wanted to run at, and that was my problem. I hadn't been running fast enough, and obviously the Great North Run's on very undulating terrain. It's not flat. The pace was too quick that I wanted to do, because I wanted to do sub 2 stupidly. But I was on for it. I was on for sub 2 until like 20k, so I was only like a mile from the end. I just completely conked out. I felt like I was going to pass out. And I told Katie, like, look, I need to stop, like I'm going to pass out. So I didn't, like, although I didn't get my goal of hitting sub 2, I think I ran sub 220. I think I ran 220 I ran. It took us 20 minutes to basically do the last mile, because as soon as I stopped, I just cramped up massively. Like I just didn't have it in my legs to run that quick over a half marathon. And Katie was absolutely mint, obviously. Brilliant. She helped us around the whole way. Yeah, couldn't wish for a better partner to run the Great North Run with. And hopefully we can do it again, but we'll see. So yeah, I'd been doing long runs. Since then, I entered the cross country league, and I've done every single cross country since then. There's been 4. We're actually running one tomorrow, which is the Northerns or the Northeasterns. I think I get that wrong every single time. Yeah, it's Northeasterns, I think. Northeasterns Championship. That's tomorrow. So I've done every single cross country this season, this year. And I've also entered the handicap race, the Grand Prix. All the videos are on my channel for both of those series. The handicap race was obviously based off of, you do 5k, and it's based off your current 5k. So at the time, mine was like 27 minutes. And you get a starting time based off of that. So like if I'm running 27 minutes and you're running 30, I'll start 3 minutes behind you, and then the idea is that everyone like finishes at the same time or close to. And I hadn't really ran like in anger at all up to then, so I thought, you know what it is, I'm going to try and push 27 minutes. I'm going to try and do a bit better. And I think it's like 5.5k actually. So I think I'd ran 28 minutes in the first one. And then since then, I've basically like that was a really good way for me to learn my levels and to be able to like push. Cross countries haven't gone so well. You'll see the videos if you watch them. I've had 2 really bad runs where I haven't paced myself properly. I've gone out too hard and tried to sustain it, and it just hasn't bloody worked. And at Lambton, we've worked out like hills, absolutely brutal. They wreck my head. And I think it's because just the amount of blood that you have, like raising your heart rate on the hills. You can't really run hills without raising your heart rate unless you walk them. And I just haven't been walking them. Stupidly, I've been trying to jog the whole way because I don't want to walk. Like, I've always had this mindset. Maybe this is totally wrong, and you shouldn't listen to anything I say. You probably shouldn't anyway. But my mind is like, I want to get better. I want to get faster. I want to get back to where I was. And it might take another year to do that, and that's absolutely fine. I'm in no hurry, really. Even though I've been told I've got like 10 years of treatment left to live, it might be shorter than that. I've got, in my mind, I've got plenty of time. I'm just trying to get fit and healthy again. So yeah, I've had some really bad runs. Lambton was probably the worst, where I had a headache halfway through it, and I just had to brutally push my body through it and try and get through. I did actually walk the hills on that. I think I walked the last 2 hills and there's 6 of them. So yeah, it was a tough run. It was not fun at all. But running fast actually hasn't been a problem. I haven't actually struggled with that at all. But it's just been a confidence thing for me. Trying to work out where my body's at, what causes the pain, and if I get pain, back off it. If I don't, cool. Next time you can push a little bit harder. And I suppose that's no different to when I used to run previously and trying to push my boundaries. If you can run a 22 5K, then you can do it again. And that's how I basically got faster and got to just under sub 20. I used to run like 20 minutes. Was my 20 minutes would be like easy-ish. Oh, well, easy-ish. 20 minutes would be like me pushing. Like that'll be where my PBs were at the time. And it was just figuring that out. What can I do without, having headaches and killing myself? So every Grand Prix has been like a really good opportunity for me to work out like how fast I can run. So I did the first one at 28. Like I said, it's 5.5K, so it's a little bit further. The second one I did at 26, so I've managing to push every single time. But it's just a confidence thing. Like, can I go out and run 26 minutes? And I'm not doing part runs anymore, so I can't really do it there. And I'm still doing my training sessions. I'm moving up through the groups. Like I said, I went back to running club. I started in the E group. And obviously the groups get faster the higher you go. Did E group for a while. Started to get fitter and stronger. Run off the front of the E group. Okay, progress to the D group. And then just build it through there. Stay in there for a month or a few weeks. Can't even remember. I have no idea how long I stayed in there for. But just progressively doing it and learning where my levels are. And then just constantly going through. And I'm in the C group now. I've been in the C group for a few sessions. And the Grand Prix, again, that's helping us because I'm learning where my levels are and trying to push through them each time. As I said, first one was 28, second race was 26 minutes, and it's like, okay, I can do 26 minutes. Next one, push again, 24 minutes, cool. And the race I did just last week, yeah, 22:11 for a 5K through that. I think the race itself, no idea what my actual time was, but just gradually learning where my levels are and pushing them. And that's been a really sensible approach for me. It's worked. It's scary, like to try and push your levels and thinking like, am I going to be wiped out by this? But I know I'm not going to do myself any long-term damage. It's just the headaches I've got to deal with, which at the end of the day, like, yeah, I still get headaches around the house as well. Like if I'm up early and I don't get enough sleep, and I have a hard day and I try and do too much, I'm getting headaches from just doing normal everyday activities, going out because on weekends we're trying to do the shopping with my little ones at rugby, we're taking the football, doing early mornings, trying to help the missus around the house and stuff like that. So I'm getting like I'm getting headaches. Cognitively going back to work, I went back to work in July, but I started off working only like 4 hours a week, and then I progressively added an hour on every day, but I only do 4 days a week, so we did it up to 10 hours, and I was working full time by the end of August, doing 40 hours a week. It actually hasn't been, I work in a technical role, I write code, so it actually hasn't been as bad as I thought it would be to try and like get my brain working again. I was a little bit worried to start with because I think the oncologist said like people that work in my job type, they tend not to go back to work. And I don't know if they just make that decision straight out, like, I'm not going back to work. But my mind is all focused on my family. You know, that never leaves your mind. I struggled massively early on with how are my family going to cope without me. When you get told, like, you're going to die at like 10 years time, well, you're not going to die, but you know you're going to run out of options in 10 years. That was massive amounts of like trauma and struggle early on. I couldn't sleep at all. If I woke up at 4 a.m, that was it. I was lying awake for 2 hours waiting for the little one to wake up, or, you know, until I eventually got out of bed. I struggled massively with that kind of stuff. But I think time again, like, I just kind of got over it. I stopped thinking about it. And it's just like, you know, I think a lot of things, like, are my family going to be financially viable when I'm gone? Is my wife going to be all right looking after my son? Because, like, ideally, like, looking at it, she's going to have to raise him from being 12-year-old. You know, what kind of trauma is that going to do to him? Losing his dad, because I've got like family mates who have lost like brothers and stuff that really young, and it sent them off the deep end, like they went mental. She really struggled at school, really struggled with jobs. They didn't take to it very well at all, and that kind of came into my mind. So, you know, is he going to struggle? Is Kim going to be able to deal with that? And it's just financial worries about them. But then obviously we've learned that, you know, I've got a good pension, life insurance is going to cover us. So we had to deal with a lot of that early on, like trying to phone up for, you know, money stuff. Like, is my pension going to cover this? Yes, it is. Cool. Is my life insurance going to cover it? Yes, it is. Cool. Excellent. Kim's sorted them, and that obviously learning that she's got, you know, all the mortgage we paid off, she's going to have a massive amount of life insurance. I've got death insurance at work. That's going to cover her. So knowing financially that they're going to be fine when I'm gone, that was a massive like amount of relief off my shoulders. And it took months and months for us to kind of get over that and to not think about it. But you just kind of stop thinking about it, and it stops entering your mind, and it's a weird thing to say, like, you just stop thinking about it and it makes it better, but it does. Like, it's, you know, it's not too bad. And it's how I'm dealing with it. Like, I just try not to think about it really. And obviously, like, I've got aspirations. Like, I want to do things with the little man. I want to, you know, I'd love to be taking him to the pub for his first pint when he's 18. You know, getting him his car, hopefully seeing him going into like higher education or getting a job and stuff when he's 18 or whatever he wants to do. Just see him grow up, really. I mean, that's all you want when you have kids. And then you're told, like, you know, that might not happen for you, and you're like, oh, for Jesus Christ. You know, I want to grow old. I want to live and retire with my wife that, you know, I've been with since I was 17, and I'm 40 now. And then you said you're just told that, you know, that might not happen for you, and it's just it's really hard to take, but that's life. That's how you've got, you know, there's nothing I can do about that now. And I think I've just kind of got used to the fact that, you know, it's all out of my hands. What is in my control is my own fitness, and I'm absolutely papping myself. I'm really scared of chemo, what that's going to do to my body and my mind, and in radiotherapy. Like, how is that going to like affect my daily, you know, my daily routine. So, and that's my main goal for getting back to running and staying as fit and healthy as I can, because like previously my fitness helped us through my surgery, my recovery. So in my mind, my fitness is going to help me through chemo and through radiotherapy. I mean, I've got no idea. I've obviously got no idea what's going to happen. But this is the only thing that's in my control, is to try and keep fit and stay healthy. So that's what I'm doing. Getting back to running. It's what I did previously. It's what I'm doing now, and I love running. I really do. I enjoy it. So it's mentally, it's great for me. Getting back to the club, seeing my friends, running, cross country. You know, cross country might be one of the bloody hardest races you'll ever do, and it is. It's horrible. But once you finished it, oh man, it's such a massive amount of dopamine. Is it dopamine? Yeah, dopamine, right? Helps you out. Yeah, but it's just, yeah, massive. And so it's the only thing in my control at the minute, it seems to be. Most of the other stuff isn't, so I'm going to try my best and stay fit and healthy. Yeah. And I think that's pretty much everything. If I've missed anything off the video, obviously if you've got questions, like I said earlier, anything regarding, you know, pre-surgery, seizure, post-surgery recovery, running especially, because that's what the channel's for. The channel's for, you know, to motivate and show you, like, look, I can get back to running. I'm doing 22-minute 5Ks. I might even go faster. I'm starting to hit like a level there where I'm going to have to start doing strength and conditioning, and I haven't lifted any weights. Like, I'm kind of scared of the weights because I'm, you know, the hills give us headaches, so lifting weights is probably going to do the exact same thing. Haven't done any of that, by the way, so yeah, we'll figure that out though. But yeah, if you're here for any of that kind of stuff and I've missed anything that you want to know, you know, just ask in the comments and I'll try and get back to you. Hopefully this video is around forever, and all my videos are around forever. So, you know, you could, if people are coming in these, you know, years in the future, brilliant. Hopefully it helps people. That's what the channel's for. That's what I'm here for. That's what I'm making them for. So brilliant. And yeah, just thanks very much for watching. Hopefully this hasn't been too long, and if it is, you can skip the bits that, well, it's a bit late saying that now, but I've the timelines in there, so hopefully that's helpful. And yeah, thanks so much for watching. Thanks for sticking around. And that's basically been my last year since being diagnosed with cancer and having surgery and just trying to live a normal life. And yeah, thanks very much. See you around, guys. Obviously, I've said this before, but I'm not allowed to video at cross country tomorrow. I'll video like the journey and what I'm doing on the day, but I can't take any point of view racing videos, otherwise I'll get disqualified. So I don't want to do that, because I'd quite like to not be disqualified. Yeah, so that's video will be coming out after this one, hopefully. And yeah, see you around, guys. Thanks very much.